Thank you all so much for joining us. So to jump right in, this year, the annual World Happiness Report outlined how the United States has fallen out of the top 20 happiest countries for the first time in the list's history, largely due to young people feeling worse about their lives. So while we are all dealing with a broader mental health crisis, I wanted to ask each of you to briefly first describe and pinpoint some of the defining contributors driving the rates of young people's mental health today. And Helen, I'm just going to start with you and go down the line.
Great, thank you. Well, the first thing is we had a child mental health crisis before our current situation. COVID and the current stresses have made it worse, but for the last 30 years, we've known that 20% of kids have an impairing mental health disorder and fewer than 50% get care. That was the number when I did my postdoc, was 50%. The number is 50% now. And so I think lack of access to high quality mental health care and the stigma has really contributed to this crisis.
Thank you. Kristina.
Yeah, I work in eating disorders, and we often say that with eating disorders, genetics load the gun, environment pulls the trigger. We always had an environment, unfortunately, that idealized thinness, but in today's social media age, that environment has just become increasingly toxic. We have young people spending an average of 7 hours a day on social media, looking at doctored images of their peers, comparing themselves constantly to those peers. I mean, can you imagine puberty, going through puberty while posting selfies of yourself on social media for folks to comment on while looking at, images of your peers, hundreds and hundreds of images each day, thinking, she's prettier than me, thinner than me, cooler than me, et cetera. So I think certainly we've always had genetic underpinnings, but the environment has hypercharged these issues.
Zoe, what about you?
As you said, we are in a world where we are receiving an information overload at earlier and earlier ages nowadays. As both a student and someone kind of working in the research field to really understand some of the treatment methods that can be used to combat this, I definitely see how constantly being able to compare against your peers, see this information, see what's happening in this place, what's happening in this place, what do we need to worry about in order to improve society in high school and college, that's increasingly making people aware of what's going on in the world, but also raising their anxiety and other diagnoses at an increasingly alarming rate. And I think that not having necessary access to support, clinicians, service, as well as stigma, which has only kind of increased over the past few years, has really impacted some of these rates.
Solome, anything to add on that?
I mean, so many great points. I would just add a false sense of community. I mean, yes, we've got so many apps and social media tools that are supposed to spur community, but really it's just isolating young people to their rooms. And that is, I think back to when I was a teen, it was AOL Instant Messenger, and I could see girls online. I'm like, oh, I bet they're talking to each other. But now, the way that social media has advanced and evolved, there's so many ways that you can spin up ideas and insecurities. And so, yeah, lack of real community is a huge factor.
Definitely. Zoe, you are deeply entrenched in mental health advocacy as a student, and you have this on-the-ground lens, right? So I want to ask you, what kinds of interventions and potential solutions are we not talking enough about that you can share with all of us?
Yeah, that's a great question. I think there's two different aspects I really want to touch on. You brought up a great point about the sense of community. We're living in a world where digital interventions and the digital world generally is becoming more prominent in all of our lives. You wake up, you look at your phone. You go to sleep, you look at your phone. You're kind of in this process where you're really seeing these pages. And because of that, you're not necessarily as connected. We are not necessarily as connected on a human level to each other as much as we could be. And I think it's really, really important to remember that. People go to college and they want to be able to socialize and learn new things, join new groups. And that's definitely still happening, but some things might now get in the way of that. People are nervous because maybe they have to post about an event after, and it adds to the pressure of actually going out and seeking connection. Additionally, we do have these digital tools at our fingertips, which gives us an incredible belt to be able to propel some of these interventions to the next level. And I think it's really important to remember that and understand how can we safely deploy some of these innovations in digital technology, in artificial intelligence, into our communities so that the people working with this technology can actually use it to better their mental health.
Yeah, you bring up a really interesting point, and Helen, I kind of want to turn to you.
Yeah.
You mentioned in the green room that there's a lot of bad mental health care out there, so I am gonna call on that. But as Zoe pointed out, when social media has also contributed to the rise in a lot of mental health problems potentially, how are you seeing digital innovation as a solution, as Zoe said?
Yeah, so those are two questions. I'm going to start with the fact that the majority of mental health care is not very good. And so if you're just looking at the standard we have now, it's not good enough. And if you look at other branches of medicine in terms of accountability, in terms of clinical pathways and outcomes, we have not held ourselves accountable as a field and haven't demanded that we teach people that that's what they deserve. Impairing mental health disorders are medical disorders. And so that's where I think getting to the question of the growth and social media, that is true. But I think it's also, in some ways, almost trivializes some of the fact that there are impairing mental health disorders that we can diagnose and we treat. And my area is early childhood mental health. The rate of impairing mental health disorders in children 2 to 6 is the same as at older ages. It's a different pattern. 50% of adult mental health disorders start before the age of 14, and the second leading cause of death for children 10 to 14 is suicide. So I think it's very important that this conversation, particularly at a health conference, is focusing on, again, a lot of the zeitgeist, anxiety, et cetera, but also that we invest in high quality mental health care that's measurable and evidence-based and doesn't start with teenagers, but actually starts in the early childhood period and goes across development.
Yeah, and thinking about how we can define, what that quality mental health care looks like. Solome, I'm going to bring you into the conversation. I mean, since launching the Behavioral Health Tech Summit and community, what have you learned about that definition that Helen brought up? What is quality mental health care? What's working?
Oh my goodness, I could not agree more. There are just thousands and thousands of digital mental health apps on the market today, which is very confusing for a lot of consumers and providers. But I've been optimistic to see, as much as it's a buzzword, measurement-based care, there is now higher levels of expectations that virtual providers, digital health companies are being held to a higher standard to embrace those practices. And just as Dr. Egger, Kristina, their companies are doing a great job of that. And so my hope is that there'll be more transparency, more outcomes period, so that plans, providers can better assess who are the companies that are actually treating folks in an effective way. So I have optimism, I'll say.
Definitely. Kristina, I wanted to turn to you. Eating disorders are the second deadliest mental illness, and the incidence of eating disorders in youth has dramatically increased in the last few decades. They also disproportionately affect youth, which you've been outspoken about. Just to highlight a couple of really important statistics, Black teenagers are 50% more likely than white teenagers to exhibit behaviors of bulimia and less likely to be screened and therefore treated. And a respondent in your Equip's recent survey found LGBTQ plus individuals were 2.5 times more likely to experience an eating disorder than their heterosexual peers. So really important information. And I want to ask you, what are some of the barriers we're seeing standing in the way of equitable care, and how do we overcome them?
Thank you for those fantastic statistics that just show how ineffective our outreach and interventions in eating disorders have really been. I think it's really important to highlight that there are large inequities in all of mental health care. For eating disorders, 80% of folks don't get any treatment. Only about 1% have access to treatment that works. And going back to Dr. Egger's point, it is so critical. access to care that doesn't work can not only be ineffective, it can actually be really harmful to folks. I have peers who've spent years and years cycling in and out of facility-based care before they've ever heard about evidence-based treatment. We know that early intervention is especially critical to get people good quality outcomes. So I'll share a story personally. We think there's a huge stereotype that still persists that eating disorders only affect one type of person. I happen to look fairly much like the stereotype of what you think an eating disorder sufferer would look like. The reality is these affect folks equally across race, class, ethnicity. 40% of those who struggle identify as boys and men. The majority of people with eating disorders are not underweight. But me, who fits the stereotype as a 13-year-old who had a history of anorexia, small-bodied person, went into my pediatrician having lost 8 pounds, history of anorexia, and the pediatrician doesn't say anything. So if I'm being missed for an eating disorder, everyone is being missed. We know that even for folks who fit the stereotype, it takes 3 years to get an accurate diagnosis. And if you're Black, if you're a man, if you're in a larger body, which we know those folks are affected equally with eating disorders, you might go a decade plus or never get a diagnosis, contributing to this being the second highest mortality rate.
Yeah, thank you for sharing that story. And I mean, when you talk about kind of these barriers, how do you get out of bad mental health care if so many people are getting sucked into it?
I think this is where payers and providers and the healthcare system really have a responsibility to step up. I talk a lot about how, mental health parity, we need to be talking about parity 2.0 and bringing in the quality factor. And I think for a very long time, Dr. Egger and I are really fortunate to be partnered with really, really fantastic payers who I think say to us, we want this. You are raising the bar in terms of showing us the measurement-based outcomes that we should expect to see in these populations. We want to direct families to care that actually works, and steerage has been a really dirty word amongst payers. That's ridiculous. That is exactly what they should be. When a family comes in crisis with the only tools that they have to wade through glossy marketing advertisements, they rely on their payers and providers to help them separate what is actually true quality mental health care from what is just what looks good on a marketing brochure.
Thank you, definitely.
And I'm speaking as I was in academic medicine for 30 years before founding Little Otter and doing it full time. We have excellent evidence base in mental health. We don't have all the answers, but we know how to diagnose mental health disorders in children starting as early as, in early childhood. And we have a number of effective evidence-based treatments, but they don't take 2 sessions. There's no quick bot that is going to really be an evidence-based intervention for a child with an eating disorder, an anxiety disorder, with depression. And I think that, I am really hoping that we should have the same standard that if you came in with chest pain to your doctor or you have cancer, people with mental health disorders, whether they're children or adults, deserve the same standard of care that's up to par with the science. And that's what I think all of our work is really focusing on, lifting that bar.
Definitely, and standardizing across the board. I want to turn to the audience. Are there any questions that we have at this moment? Any that I'm missing? Okay, yes, we have one over here.
Hi, great panel. I'm not a parent yet, but have a bunch of nieces and nephews in the middle school and high school area, so I kind of see it. I think it's easy for us to point to the screens and social media and tech companies as the boogeymen. Trust me, I'm no fan of social media and what it's doing to the children, but a comment on, or a question, the community loss aspect. I don't want to point fingers and generalize parents, but where do the parents fit in on all of this, in you guys' opinion? And then if we are actually identifying that this is everybody's issue and not just the kids and the phone, what should we do from a policy standpoint at the government level as well? Because I think we've identified a pretty big accelerator of it.
Yeah, thank you.
Well, I'd love to address that. I mean, I think that's a critical, I personally think there's a contribution, but I think it's also an in vogue boogie, man, this is the cause of all of our problems. What we do at Little Otter is we take what we call a whole family approach. So we assess children and parents, and we provide mental health care for children and for parents and couples work and family therapy in an integrated approach. And so I think the point that you're making broadly is you never can be treating a child as an isolated individual. A child lives in a family, the relationships, and if parents are themselves having mental health problems, that has a huge impact on the child. And I think the other thing as an early childhood person, it's the parents' use of phones that concerns me much more than children. If you go to a park nowadays and see people with young children playing on the playground and the parents are looking at their phones and not interacting with their child and not interacting with their baby, that is really impacting the architecture of that baby's brain, because it's through social relationships and social interactions that we set the foundation for healthy emotional and behavioral health across the lifespan.
I just want to add to the comment that families are absolutely critical. For so long, mental health is so far behind physical health in so many areas, but one of the biggest ones that's been so detrimental is performing these parentectomies, really removing the families and actually blaming the families.
Right.
It is one of the few areas where we still blame families, and we know—
Mothers particularly.
Absolutely. Decades of evidence shows us that not only are families not to blame, they are our best asset in getting kids to a healthy place in recovery. We talk often for eating disorders, but it really does apply to many serious mental illnesses, that these are brain disorders. Right. They require you to fight your brain many times per day. It's not only ineffective, but actually kind of mean to treat that as an individual illness. You need to bring in the people who love the child most. And some people will say, in the case of eating disorder as well, if the family has, issues with diet culture and stuff with food and body, we absolutely need to exclude them. Absolutely not. All the more reason to include them, because at the end of the day, that child is going back to live in that family system. And so how do you set up that family system for full health and full recovery?
Solome, I wanted to turn to you, to comment on that, but also, we're talking a lot about the importance of community and connection in terms of solutions, right? We're in a global loneliness epidemic. So when you're thinking about tech innovation, how are you balancing that with the importance for community and connection?
Mm-hmm. Yeah, I'd love to comment on the policy piece as well. So for me, thinking about a scale of innovation, on one end of the spectrum, it's like totally Jetson, AI, all the novel, cutting edge stuff. And on the other end, it's just putting one-on-one therapy online, not really doing anything to scale our dire shortage of a workforce. I'm most excited about this middle ground where the provider is still in the driver's seat, but it's the technology that is expanding their reach to that many more patients. And I use the term provider loosely. That could be a peer or a coach. And so those are the kinds of solutions that I am very excited about to help, especially reach young people on tech where they're comfortable receiving care, but also people heal in relationships, as Dr. Egger mentioned, and having that provider connection. And that, in partnership with the Commonwealth Fund and Meadows Mental Health Policy Institute, my organization, Behavioral Health Tech, we took these, which we called workforce extenders, and we came up with some recommendations for the administration to be able to have some near-term strategies to disseminate youth digital mental health tools more broadly in the Medicaid market. And one of the first steps that we offered was just even defining what agency is responsible for what, so that innovators can know how to navigate the government to be able to partner and disseminate these tools. So a lot of opportunity still there.
Yeah, and we could talk about this forever, and I have so many more questions, but I did want to just ask one more quick question for each of you. It can feel really daunting to be on the front lines of mental health care, so first of all, thank you. And I would love to ask, in a word to a sentence, however you want to take it. What do you see as the next frontier of mental health care? Zoe, I'll start with you, and I'll go back to Solome and then back around.
I think that this last conversation geared towards psychoeducation and just involving the entire community into understanding what mental health care is and what the options are is critical. And I think integrating this into society, into the information overload that we are already receiving, is the perfect opportunity to do so.
Solome.
Mine is partnerships. We've got amazing solutions, but now it's time to work together. A lot of payers already have solutions in their portfolio, so how are the new innovators going to come and coexist and integrate with them?
Perfect.
Digital mental health interventions not only have the ability to expand access to evidence-based care that works, but actually to take the evidence-based care that we know and make it better through measurement-informed care and learning on more diverse populations.
Yeah, and I would say accountability. And accountability from ourselves in the mental health field, but also from payers and the psychoeducation and empowerment of parents and children to be able to demand the care they deserve.
Yeah, it's a great way to end. Thank you all so much. Really
Thank you.
appreciate it.